Tarpon Springs was the first incorporated city in Pinellas County and was originally a resort community for Northerners. Sponge diving was a commercial industry based out of Key West until fishermen discovered the vast sponge beds in the mouth of the Anclote River. The first sponging business was opened in 1890. By 1900, Tarpon Springs became the largest sponge port in the United States. By 1910, John Crocoris, a Greek sponge buyer from New York, had revolutionized sponge diving with his mechanized sponge fishing boat. He and his brothers brought 500 Greek divers back from Greece to work the sponge beds and build up this rapidly growing industry in Tarpon Springs. These 500 Greeks moved their families here and established their own sub-community within Tarpon Springs. They opened their own restaurants, coffee houses, and grocery stores, leading to the rich Greek culture in this community. Today, Tarpon Springs is a busy tourist attraction year-round where people can experience traditional sponge diving tours, guided fishing excursions, numerous Greek specialty shops and restaurants, wonderful parks, beaches, and schools. The structure of this community is similar to nearby communities such as Holiday and Palm Harbor in regards to the residential and commercial areas. Tarpon Springs and Palm Harbor both have their own fire departments, whereas Palm Harbor does not have their own city police department. There are small and large businesses in both cities, Tarpon Springs' largest business being Florida Hospital North Pinellas, while Palm Harbor's largest company is Palm Harbor Homes, a manufactured home company. Both cities have varied denominations of churches for worship. Both cities offer multiple elementary schools and one middle school. Palm Harbor now has 2 high schools, while Tarpon Springs still has just 1. Tarpon Springs and Palm Harbor share access to the Pinellas Trail, which connects the southernmost part of Holiday all the way to St. Petersburg, accommodating bicyclists, runners, and roller skaters alike. What makes Tarpon Springs unique from these other neighboring communities is its multiple parks, including a community water park for children, dog parks, beaches, and weather-protected outdoor exercise equipment to provide opportunities for residents to engage in physical activity. Tarpon Springs is incorporated with its own mayor and city commissioners, whereas Palm Harbor is unincorporated and is run by the Pinellas County Commission. Palm Harbor does have a 7-member board of directors that meets monthly for meetings. Neighboring communities have community events. However, Tarpon Springs sponsors activities throughout the year and has the Spring Bayou, which allows for boaters and kayakers alike to be able to participate from the water as well. Holiday does have a small public beach, but it dulls in comparison to Fred Howard and Sunset beaches in Tarpon Springs.
The population of Tarpon Springs is on the incline over the last 10 years. Tarpon Springs, along with Pinellas County, have a seasonal influx of snowbirds, October through April, adding an additional 46,000 elderly adults in need of health-related services. Tarpon Springs is comprised of mainly Caucasians with the largest community of Greeks than any other city in the U.S. Nearly half of all people living in Tarpon Springs are older than 50. The graduation rate in Tarpon Springs is higher than that of the county and state average. However, individuals seeking higher education is lower than state and county. The unemployment rate in Tarpon is consistent with Pinellas County and state level. 14.8% of families of 4 live in poverty, which is consistent with county and under that of the state. Our community is at risk for being uninsured, underserved, without primary health care providers, leading to lack of primary prevention. An increase in the aging population during the winter months increases our risk for communicable diseases such as influenza, community-acquired pneumonia, as well as an influx in individuals that have chronic health-related conditions. Health-related resources are available in the community of Tarpon Springs. Our public health department offers supportive services for elderly and women and children, health screenings for uninsured and refugee population. Our health department also oversees the cleanliness and safety of our community through quality inspections. This community-based center has community goals to aid in some of the population's issues such as controlling diabetes, hypertension, and ensuring everyone is immunized. Tarpon Springs has outreach programs such as wellness ministries run by Susan Traylor that serve underprivileged, poverty-stricken, and homeless populations. Services are offered such as free clothing, health screenings, job resources, social services, referrals to doctors and dentists, as well as meals and personal items. Our community is lacking in shelter and places for homeless to shower. We also lack in 7-day-a-week soup kitchens. Tarpon is neighbor to Palm Harbor, where multiple similar resources are found offering choices for care. Meese Countryside Hospital is minutes away for alternate hospital choices and for pediatric and neonatal care. Resources in our community can be costly, especially for the unemployed, uninsured, and for people who live at the poverty level. Although resources are available, they are often not sought until serious illness occurs. For the reasons I have stated, healthcare is simply not attainable for all. Healthy People 2020 have many objectives. For Tarpon, the following objectives are the most important. First, access to healthcare and health insurance. It is proven that more people will utilize health-related services if they have insurance. The goal for 2020 is 100% to have health insurance. Access to care, such as getting to appointments for those who don't drive or are disabled, more walk-in clinics, low-income clinics, and visiting physicians would help the community of Tarpon Springs. Having insurance helps people to obtain care they need on an ongoing preventative basis. The second 2020 objective is examination of social determinants such as education. People with quality education are more likely to be healthier throughout their lives. Healthy People 2020's goal is for 82% of the population to graduate on time. Currently, we're at 81%. Lastly, due to our aging population, heart disease and stroke are leading the way in deaths in the United States. Education is the key. We need to take an opportunity as nurses to educate our entire community.
The City of Tarpon Springs allocates a significant amount of its expenditures towards protecting the physical environment, demonstrating the importance of protecting the environment to the community and its officials. The air quality in Tarpon Springs falls into the good range, according to the EPA. The city provides quality water and sewer services to all of its residents. It also provides a location for yard waste disposal within the city limits. The city relies on Pinellas County to provide routine trash pickup, recycling collection, and animal and vector control for the community.
The City Commission is responsible for legislative and policy matters for Tarpon Springs. Mayor Archie acts as chairman of the board of the City Commission. City Commissioners include Jeff Larson, Townsend Tarpani, Rhea Sieber, and David Banther, and they are accessible to residents of Tarpon Springs. The City Manager, Mark LaCourse, attends public meetings as well and is available to the residents of the community. Public meetings are held on the first and third Tuesday of each month in the City Hall. These are televised sessions and citizens are allowed to address the commissioners at this time. According to the Tarpon Springs physical budget for 2015, the top 3 allocated expenditures include the physical environment, public safety, culture, and recreation. The budget provides for all aspects of the community. One area of economic concern that was addressed during a recent session included programs to revitalize downtown areas while maintaining Greek heritage and promoting tourism. Considering the recent death of police officer Charles Conduct in December of 2014, safety of the community and its officials is another primary area of concern for Tarpon. 6 overall community needs include nutrition, exercise, access to health care including dental care, smoking cessation, assisting with job placement and employment opportunities, and assisting with transportation. Nutrition and exercise are top priorities because they affect the entire community, including adults, children, and all socioeconomic classes. Obesity, hypertension, and other preventable health problems can be addressed by promoting healthy dietary choices. A community nurse could offer programs to educate the entire community about healthy lifestyle behaviors that would benefit everyone. Nutrition is a global community issue as well. In Athens, Greece, the socioeconomic crisis has affected the most vulnerable group, children. A survey of Greek schools estimated 25% of the children were suffering from hunger and another 60% from food insecurity. Providing healthy food to all students, including fruit, milk, and yogurt, helps meet dietary requirements, including energy and protein needs. The number of children who were underweight dropped 48%, and 13% of obese children dropped to their regular weight through this preventative program. According to the Florida Health Department, 65% of adults in Florida are at an unhealthy weight. 1 out of 3 kids are now considered overweight or obese. In the United States, we have federally funded child nutrition programs and school meals, including the National School Lunch Program, the School Breakfast Program, the Special Milk Program, and Team Nutrition. These programs provide healthy nutritional choices and encourage physical activity to promote healthy growth and reduce obesity risk. Well-nourished children are healthier, more attentive, and have better mental performance than children who are undernourished. Locally, the Mayor's Fitness Challenge encourages the entire community to make healthier lifestyle choices. A community nurse could intervene by providing education.